A nation divided not only by politics, but also access to healthcare. For many Americans, healthcare is a waiting game. We wait for appointments, test results, and for the day when we can actually afford healthcare. But when exactly will that be? The manhwa, Medical Return, highlights the problem that unchecked healthcare access causes decline in health. But why don't we do anything about this? It has to do with unrelated healthcare prices and healthcare access. Healthcare access is as it sounds, the ability to obtain healthcare services. In America and other third world countries, according to the University of Missouri's School of Medicine, many people do not have access to adequate healthcare, which is honestly ironic considering the estimated amount of unpaid healthcare debt being $140 billion in 2021. So, I wonder why so many people do not have access to adequate healthcare in America. One of the reasons is the price.
I needed to see a gastroenterologist about a year ago, and I managed to get a 15-minute call with one, and I got charged $900 for that 15-minute call.
To be charged so much for a simple call without any insurance is highway robbery. Prices like this exist because there isn't a standardized set amount of anything. This is due to the lack of strict regulation, which could be achieved with universal healthcare. But I'll touch on universal healthcare at a later point. The real question is, how does healthcare inequality relate to the manhwa Medical Return? Medical Return follows the disreputable surgeon Kim Jihyun, who got another chance at life. He regressed to his middle school self to change his fate. With his past medical knowledge, he quickly becomes known within the medical industry in both South Korea and America. However, his goal isn't to prove that he's a reliable surgeon, unlike the failure he was in his past life. His goal is to make a lot of money and become a dermatologist instead of suffering the difficult hours with low pay as a surgeon. This next portion contains spoilers of the manhwa. As I said, Kim Jihyun used his previous medical knowledge to make a name for himself. He's no longer the unreliable surgeon of the past. However, his newly found success made him a target of envy and resentment. Not only is he a target of his classmates and sunbaes, but also corporate bigwigs. Due to the target on his back, Kim Jihyun was assigned during his internship a chronically dying homeless man. The higher-ups want to find anything in order to tarnish his reputation and credibility. So, they gave him an impossible patient to care for, but Kim Jihyun never gave up on the patient. Even though he talks about wanting to go into dermatology for the money and for the simple work schedule, it doesn't mean he'll let a patient suffer because of healthcare inequality. While a doctor he was working under told him to discharge the homeless man, stating that money doesn't grow on trees and hospitals aren't a charity organization, Kim Jihyun decides that he will pay for the bills with his own money. His actions highlight the systematic flaws in the healthcare system that prioritizes profit over people. In South Korea, universal healthcare has been in place since 1988, ensuring that all citizens have access to essential medical services. This would have allowed the homeless man to potentially afford healthcare. But what exactly is universal healthcare?
Instead of every private insurance company negotiating with every healthcare provider, there's just this big list. Country, the central government, they go and they say, if you want to sell to us, to all of our people, then here's what you can charge for a checkup. Here's what you can charge for an MRI or a prescription for Lipitor.
By establishing standardized prices for healthcare services, governments can exert great control over costs. Providers who refuse to accept these prices risk losing business, as they will no longer be included in the government's network. While this sounds like a dream, there's also drawbacks. One potential drawback of universal healthcare is the often talk about its need for government funding. Taxpayers contribute to support the system, which can often lead to debates over allocation of resources. This leads to the argument that tax rates will increase, which can place a burden on individuals and businesses, especially with lower income. However, I'd rather pay more in taxes than have an underpaid and overworked doctor do my brain surgery. Yeah, I'd rather deal with my malfunctioning brain, thank you very much. But I understand the fear. But it has been proven that while the amount of tax you pay does increase, the amount of healthcare expenditure per capita or per person significantly lowers. So in the long run, you pay less money. But can we really relate the example of medical return to actual facts? It's a fictional story with supernatural elements, such as regression and some divine intervention. While there are specific circumstances of how Kim Jihyun ended up with a homeless man as a patient, doesn't mean that there aren't real stories like this. Homelessness is a problem not only for America, but the world. In America specifically, according to the National Healthcare for the Homeless Council, the federal government reports 1.5 million people a year experience homelessness. But remember, that is just the ones who have been reported. Living on the streets or in a crowded homeless shelter exposes many individuals to diseases such as TB, respiratory illnesses, flu, etc. But how can a person who can't even afford to live under a roof expect to pay for their medical bills? Some homeless shelters do offer medical services, such as the Landing in Rochester, Minnesota. However, not everyone is as lucky. So why would a homeless person without access to healthcare see a doctor? This is the same question when referring to people who live in poverty. It's just too expensive. And even if they do end up deciding to visit the doctor, a lot of people struggle just to get an appointment with a primary care physician.
It has a lot to do with insurances. Patients who don't have good insurances have it even harder to get primary care doctor. There are certain insurances that they are not taken by different clinics, and those poor patients can't get access. It's even harder for them.
Unless you want to spend up to 20 grand on an ER visit, the amount of time it takes to get an appointment or a test result can be the difference between a simple injury and an infection. According to a survey conducted by the American Association of Nurse Practitioners, 40% of those who responded experienced a longer than reasonable wait for healthcare, and about half of those 40% never actually received treatment. Believe it or not, this does include patients who sought critical medical health service. And all of this stems from either not wanting to go to the hospital until it becomes an emergency, or not being able to afford it until you land in the emergency room. And it's honestly really sad. As for myself, I would say I've had a mix of both perspectives, maybe not in the sense of the emergency room, but I have been lucky enough to have my medical troubles easily solved within 1 or 2 hours of me calling for an appointment. However, I too have experienced the long wait of trying to get an appointment with my primary care provider. So, each and every person has their own life and own experiences, and this also varies depending on your insurance and cost of living. This Mooncher has been very lucky so far. Trust me, I know, but not everyone is as lucky. And honestly, I feel for anyone who feels the need to avoid going to the doctor in fear of the high cost it brings. No one should have to ever feel that way. Access to healthcare should be a right, not something that will cost you a kidney in order to afford it. While people dislike the idea of universal healthcare due to the tax increase to, in theory, pay for other people's healthcare, it's something that causes people to get sicker and sicker. A lot of people dislike universal healthcare due to its relationship to socialism. Of those who dislike socialism, according to Pew Research, about 90% of those people say that socialism undercuts people's initiative and work ethic, making people too reliant on government support. And it's honestly something that should be thought about, even if you disagree, because this is a real fear that people have. However, even if your taxes do increase, when the time does come when you need emergency care, being able to afford going to the doctor may save your life. And if you found discussing the relationship between medical return to the problems of healthcare inequality, you may also like this anime discussing how buying cheap diamonds doesn't mean you love them any less.